Hi everyone, my name is Jonette Payton. I'm the Health Promotion Project Manager with the National Center for Health and Public Housing, and I'm here today interviewing Dr. Astral Webb.
Thank you, and I'm Dr. Astral Webb, the Director for the National Center for Health and Public Housing.
And we are here today just to give you guys a brief introduction to the National Center for Health and Public Housing and the Public Housing Primary Care Centers. So first, Dr. Webb, can you briefly tell me about the National Center for Health and Public Housing?
Sure. So the National Center for Health and Public Housing offers training and technical assistance to health centers. We are partially funded by HRSA to provide training and technical assistance for health centers to increase their capacity to serve residents in public housing. We offer this through various mechanisms for training and technical assistance, from webinars to on-site visits to conferences, sharing publications. We help identify best practices that are being used by various health centers, and then we share relevant research findings on what's happening with the health status for residents of public housing.
Great. So can you tell me a little bit more about public housing primary care organizations and how they work to improve the health of public housing residents?
Sure. So the public housing primary care health centers are uniquely and conveniently located, usually on site of housing authorities or in the vicinity of housing authorities, and the residents themselves tend to be on the bus lines for most of the models. And they provide primary care as well as preventive care services, so they truly provide a medical home model for the residents. And as you know, residents have been shown to have the worst health outcomes of many of the populations, especially in the housing environment. And so because the health centers are located so close to them, it also reduces the inappropriate use of emergency room services.
Can you name a few of the strategies that PHPCs use to actually engage the residents in the services they offer?
Absolutely. So PHPCs have to be very innovative and creative in reaching this very difficult to reach population. And so they may use a community health worker, which may be a resident in public housing who's trained to engage other residents to really take better care of themselves and their health. And many of them are employed by community health centers, and they help them along their health plans that are served for residents. So some of the health centers are part of the community collaboratives where they are, and so they work closely with schools, churches, other nonprofit organizations to really bring the social services that would support the health services. So we usually term that the social determinants of health. So, and many of the health centers put on a number of community events, from health fairs to back to school programs to vet stand down programs as well. And so they really reach the residents in this way, sharing information on health and prevention. And most of the public housing primary care programs, especially those in the rural areas, actually use a lot of the mobile vans. And these provide services on school-based sites, of which they have the school-based health center program, but also they provide services such as mammograms. Sometimes they offer behavioral or oral health services that are usually available 2, maybe 3 times a week for the residents.
Great. So you mentioned sharing health information. Looking towards the future, can you tell me how these health center programs are working in conjunction with the Affordable Care Act?
Absolutely. Well, the Affordable Care Act has opened up the avenue for these health centers to expand primary and preventive care services. As you know, Jonna, the PHPC programs serve the medically underserved populations. And so conveniently, they are there to provide not just primary and preventive care, but they also provide oral health, behavioral health, pharmacy services, radiology services, as well as translation services in order to provide the culturally competent care that you really need to provide for residents. It's important for them to provide sometimes anywhere between 3 and 33 languages on any given day. And so the multidisciplinary teams built at these PHPC programs are equipped to take on this expansion and see these various diverse populations seen in PHPC. They also help keep the residents engaged, up to date on all the changes under the Affordable Care Act, and mostly help the residents themselves get enrolled for insurance. As we know, much of that is done through the marketplace exchanges, but also for the PHPC residents, many of them qualify for Medicaid and Medicare, and so the health centers themselves will help them enroll for that. And again, the PHPC program is known to be a very patient-centric model, and so they do provide all of the services in-house to make it a one-stop shop for residents.
Thank you for providing such a great overview.